the pharmaceutical package has been a hot topic for many months. At what stage it is its implementation?
Yes. So obviously, just to reiterate, the pharmaceutical package, the reason it's so important is that it really is looking at the whole value chain from research through to production, approval, reimbursement, distribution. So it's looking at every aspect of the pharmaceutical industry. And the aim is to ensure access to medication for patients, but also to ensure a competitive pharmaceutical industry within Europe. So it's a very important piece of legislation. And of course, the reason it's important is it will set the scene for decades to come. So the decisions we make now will affect things in the future. The stage it's at is obviously it's been a very complex piece of legislation, and it's gone through a number of iterations since the original proposal. The Polish presidency has really moved things forward significantly. I think there's probably one key area that is still to be negotiated, which is the regulatory data protection. And that is something that is really core to investment of innovative companies. So that's the stage we're at currently.
Okay, and what will the package change for innovative companies? What opportunities and what risk does it give them?
Well, obviously, I explained the breadth of it, so it's extremely important. It's going to affect every single aspect of our operations. And I think the thing is, obviously, on the one hand, the legislation is there to ensure access to medication, and that means physical access, but also economic access. Although also we need to think about how we encourage the competitive industry. So sometimes there is a balance to be struck. I think the important thing to say is, if you look at the current status of innovation in Europe, it's actually quite a worrying picture. Okay, because over the last 10 years, as one example, clinical trials globally have grown by 38%, but Europe's share of that has halved. We also are falling behind in terms of our increase in investment in R&D compared to the US, and especially compared to China. And we're already seeing an impact in terms of the new molecular entities that are available, which come from China versus the EU and US. So the current status is that actually we're losing the race, and we did always enjoy a leadership position, but that is absolutely in jeopardy. And the current let's call it social economic situation with US and tariffs make it even more important that we incentivize the industry within Europe, because the need to relocate R&D into the US is increasing, and therefore we need to think about the incentivization within Europe.
Actually, I wanted to say how might the announcement of tariffs in the US affect Polish patients?
Yeah, well, in the short term, look, supply chains in pharmaceuticals are very complex, okay? And obviously, any disruption within that supply chain, which tariffs would present, could potentially cause short-term issues in terms of supply. So as an industry, we're very much focused on ensuring that we take all the necessary measures to protect ourselves and protect patients. I think it's important to say that when you look at innovative medicines, already around 70% of all innovative medicines in Europe are produced in Europe. Okay, so that's good news. But I think in the short term, we also need to think about what other impacts there could be. Long term, obviously, I've already mentioned that there'll be incentives for companies. I mean, you know that the US is a very big market, and the administration in America is encouraging investment within the US. So obviously, that's why we also need to think about the brain drain and the shift of R&D investment and capital investment from Europe to the US, and we need to protect against that. So that gives even more argument to the fact that we need to protect the industry, and we need to create a supportive and environmental situation that also protects patient access, not just in the short term, but in the long term as well.
The world is changing. The pandemic and the war in the Ukraine have activated discussion about drug safety.
Yes.
What should it look like from your perspective, and what should Europe and Poland bet on?
Well, I think the one important thing to say is that I think one of the successes of the Polish presidency is that health has been elevated to a topic of security. Okay, so that's very important, and I think Poland, along with the EU, are making steps to ensure security of supply. As an industry as well, I think COVID was already a key reason why we needed to look at supply chains and make sure that security of supply in Europe was ensured. So that has been ongoing. I think as well, though, I reiterate, it's not just about the short term, it's also about the medium and long term, because, the generics that we have today, the medicines that we have today, they will not exist in the future in Europe unless we obviously create the innovation to make them happen.
Yes. Is everything worth producing in Europe? For example, if it comes to active substances, would it significantly raise prices if they were produced somewhere?
So, again, supply chains are very complex, and I think when you think about security, it's a little bit too simplistic just to think about production in Europe. Okay, we also have to consider, if we are getting drug supply from other countries, what is the stability of the country? What is the situation as far as tariffs is concerned and the trade arrangements? So, because I think it would be very difficult to produce everything within Europe, and it would affect costs. So when we look at security, we do need to think about production in Europe, but we also need to think about reliable partners outside of Europe as well.
Okay, and the last question, what solutions does the industry expect from decision makers at the national and European level?
Yeah, I'm coming back to the topic of regulatory data protection, because currently, if you look at nearly every criteria, let's say, of encouraging innovation, then Europe is behind America. So America has a much simpler, more streamlined regulatory and reimbursement process. They have longer data protection, especially when you're looking at biological medicines, because they have 12 years versus our current 8 years. And the proposal is to reduce that to 7 years. So, we really need to think seriously about ensuring that we keep Europe competitive and incentivize and value innovation. So for me, I think the critical bit is completion of the pharmaceutical package, and as part of that, taking seriously the importance of regulatory data protection.
Okay, thank you very much for the interview.
Thank you.